everyone, I'm Mehrnaz Campbell, founder of Kimi and author of The Omni Advantage. Welcome to our first episode of LinkedIn Live this year, and I'm really delighted you decided to join us today. I'm dialing in from Knoxville, Tennessee. It's a really wet, dark, kind of cloudy day. What about you? Where are you joining us, and what's the weather like where you are? It'd be really cool if you could just pop a message in the chat to say hello and let me know where you're dialing in from. But more importantly, what inspired you to join this conversation today? You know, at Kimia, our purpose is to unleash the human potential to create a healthier world. And our work focuses on helping pharma leaders to shift from simply delivering messages to healthcare professionals to becoming their trusted advisors. And over the last 4 years, through these digital transformation series, we've tried to spark conversations, challenge our own thinking, and build real connection, and ultimately improve the outcomes for healthcare professionals and patients. I feel really passionate about improving the way we engage healthcare professionals and really aim to truly add value to them. And that's why I've invited inspiring leaders to tap into their expertise and learn from their experience and their insights. But today, it feels to me extra special because today we have the opportunity to hear directly from a practicing doctor in the UK, someone who sits on the receiving end of our email, our content, our campaign, and can tell what resonates, what feels useful, and perhaps more importantly, what feels like noise. I'm really delighted to be joined by Dr. Azmain Chowdhury. Azmain, it's genuinely a pleasure to have you here. Thank you so much for joining me today.
Mehrnaz, that's so kind of you to say. It is my honor to be part of this LinkedIn Live.
No, I'm just really always enjoyed chatting to you. But before we dive into a conversation, I just wanted to take a few moments to introduce you properly to everyone. In case you don't know, Dr. Azmain Chowdhury is a practicing medical doctor in the UK. And also I would like to describe him as a clinician creator. He has over 500,000 followers across social media. What I admire about Azmain is that his content is rooted in is very rooted in credibility, evidence-based health education, but he delivers it in a way that is engaging, accessible, and often reaches millions of people. Azmain also advises industry and healthcare professionals on how to engage more effectively with each other and with patients. So he really sits at this intersection between medicine, communication, and influence. He's a member of WHO FIDES, part of the TikTok Clinical Creator Council, accredited by YouTube Health and by the Patient Information Forum. In 2023, he won the MHP 30 to Watch Gold Award and was recognized as a health champion for his contribution to public health. And he has collaborated with UK government, with NHS, WHO, UNICEF, and many other healthcare organizations and charities. And I have to say, he's not even 30. Azmain, that is seriously impressive. Congratulations on what you've achieved so far. I mean, it's incredible.
Thank you so much. Thank you.
I don't know what you're going to do by the time you get to 40. Like, I think we need to just hold our breath. It's amazing.
We will see. We will see. But I'm going to keep trying my best.
So I was going to say we've got a few people saying hello to us. Lisa, hi, it's great to have you joining us from Hertfordshire. We've got Natasha from Birmingham. Hi, Natasha. I can just feel your enthusiasm remotely, knowing that you're going to contribute to this chat. And Jay Patel, it's so good to have you here from Oxford. Oxford is one of my favorite cities. I had an opportunity to spend quite a bit of time in 2024 there doing a course in Saïd Business School. So I've got questions for you, Azmain, and I just wanted to say before we jump into questions, I usually ask our speakers to just like look back, to think back, how did we first met? Do you remember how we first met?
I do remember when we first met. I think it was the very lovely James Harper who introduced us towards trying to think, was it the beginning of last year?
Probably either end of 24 or beginning of
End of
25.
24, beginning of 25. Yeah. It feels like I've known you for so long now.
Same here, same.
But I think I always find it funny how my connections came into the pharma industry. I think I met the brilliant Rena Newton at one of the YouTube Health events. She asked me to speak at one of her Code Clarity events, which is where I met Paul Sims and met James and then met you, and have become part of this incredible circle of, I think, what Paul likes to call pharma provocateurs. And I think that's a brilliant phrase to describe the disruptors and innovators who are trying to make pharma even better and to challenge the industry to achieve, the best for business, but the best for the clinicians and the best for patients as well, and to bring that all together. So it's genuinely an honor to be part of such conversations.
Oh, that's so lovely. And you mentioned three of my favorite people, Rena, James, and Paul. And I've got so much respect for each of them. And I think it's always, for me, it's really interesting, this kind of like new ways of working, the digital connection, how that can turn into real proper conversations and helping us connect with each other. It's a power of, using digital channels to connect, because, when I first started talking to you, I was sitting in America, you were in the UK, but geography is no longer a barrier now. And it kind of shows how we can use social media and other ways of connecting and communicating. But I remember first I met you in person, and your sister Jaiza was in the beautiful sunny Dubrovnik in May last year, when we were both speaking at that conference. So yeah, it was so lovely to see. And I think at the time I was doing some volunteering for PM Society, and you helped me capture a lot of really good content from you on video. So thank you so much for that as well.
So glad to have contributed.
Yeah, no, it's amazing. So as I said, I've got plenty of questions for you, but this is not about me. This is a live event, so you really want to have contribution from our audience. I want to encourage you to pop your questions in the chat and kind of get involved in this conversation. As I said, Azmain sits in this unique intersection between clinicians, content creator, but also advising the industry. So if there's something you've been thinking and been dying to ask a practicing clinician, here's your chance. And if something, as Azmain says, resonates with you, give him a thumbs up. And if you see him say something, you disagree with it or say it differently, challenge us, obviously respectfully. But debate is always really healthy. Diverse perspective help us think better and with a wider lens. So please join us. I really genuinely want to hear from you, and I will pepper your questions throughout this conversation. But to get things going, I wanted to kind of remind everybody, Azmain here is representing his own views, and respectfully ask everybody not to mention any products, pharmaceutical products by name. But I'm going to start with the first question for you, Azmain. What prompted you to step into content creation, and what have you learned about building trust at scale through your work with large online communities and organizations such as WHO and the NHS?
Absolutely. So I think it was around 5 years ago that I first started creating content. It's been around about the 5-year anniversary. I remember when I first started, I gave myself a promise that I would try this out for 5 years. If I see no kind of movement within that time, then I would consider quitting. So what is it that actually prompted me to start? It was the fact that I was graduating my final year of medical school straight into the COVID pandemic. We were graduated early back in April 2020. And then, some of my colleagues joined straight away. I joined at kind of the normal joining time of August. Looking at social media at that time, I didn't know. I'd never set foot on TikTok before. Instagram was alien to me. But YouTube was, I'd been posting YouTube videos since like 2010, 2011, posting my music performances with my band and my original songs. So I'd always kind of been a creative. But obviously, med school happened. I focused on my education to become a good doctor. And then the pandemic hit, and I realized this influx of misinformation on social media. It's like the Wild West. And at the time, it was not a place where qualified healthcare professionals were really well represented. So I realized this is the perfect opportunity whereby I can use my creative talents as well as my medical expertise to create high quality, visual, engaging content that really captures the attention of not just fellow medics, but the general public as well. Because, simply put, you scroll enough on TikTok with your thumbs, you will find some crazy misinformation. Ultimately, if you can't beat them, join them. So we have to be there, present, to show, this is what real, credible health information looks like. And by and large, people have really resonated with it. Some of the content that I've made is, direct, just health explainer and education. Some of it is explaining news topics in a very simple way and trying to reduce the amount of jargon. Some of it is much more gamified, like my trademark medical quizzes. I've had friends come up to me and just go, Dr. Azmain's medical quizzes. So it's literally the branding and stuff.
Yeah, it's cool. You saw a problem, something that didn't sit right with you, and you decided to step in, use your transferable skill from music and just create something that is credible. So good on you. You should have shifted from being an NHS doctor to becoming a trusted digital voice. So let's talk about your life inside NHS in general practice. What does a typical clinic session look like for you, and where do you feel the pinch, the pressure? And the reason I'm asking you this, because this is my gut feeling. I think often pharma misunderstands the day-to-day reality in general practice, and I just want you to give you like a window into the reality of what is causing you pain during a day and what are the pinch points.
Of course. So I will caveat that I am a GP registrar early in my journey, so I can speak to my own experience, but I can also see what the senior GP partners are actually doing in their day-to-day, how they're actually spending their time. It's weird because I just saw a headline come up on my phone saying, we're not talking about how GPs aren't working hard enough. I was just immediately triggered. I haven't had the opportunity to actually go and read it, but I'm just like, what are you on about? This is clearly written by someone who has no idea what the life of a GP is like. And I've had a glimpse into both hospital medicine and GP medicine and what the lifestyle is like on both sides. And I'm going to be honest, there is sometimes a little bit of friendly fire in terms of the GP bashing that comes from hospital medics. They're like, oh, they don't know what they're talking about. I'm like, you need to kind of respect the jobs that your colleagues are doing, and we all need to be supportive of each other. If we're not supporting ourselves, we can't really expect other industries and the public to support us. The reality of GP is that it is bloody hard. And there's no clearer time to learn that than, like, for myself, when you first enter GP training. The standard GP appointment is 10 minutes. I'm lucky because I get 15 to 20 minutes starting out. It's impossible. It really is. You can get the occasional UTI or viral upper respiratory tract infection that you can sort out within, for me, 10 to 12 minutes. That an experienced GP would be able to do in 5 to 6. But ultimately, you still have to get that patient in through the door. As long as they're not running late, as long as you're not running late, you need to take the history. You need to figure out the hidden agenda. Like, is the patient telling you exactly what they're actually here for? Or can you anticipate that hand on the door moment when they say, by the way, doctor, and then drop an entire bombshell on you? You have to maintain a level of distance, but also the empathy to understand what that patient is going through. You have to be assertive and say, you know, this is what we actually have time for, and this is what you'll need to book another appointment for. Then you have to examine the patient. You have to spend time actually putting the puzzle pieces together to figure out, hang on a second, what am I looking at here? That's something that only comes with experience. Like, you can read as many guidelines as you like, but some things only come with experience. And then you try and sort out, you know, what is the appropriate next steps in terms of management strategy options 1, 2, 3. Then you explain that to the patient. You have to work in partnership with the patient, because medicine is no longer paternalistic. You can't just force an option onto a patient. You discuss with them, what do you think is the best option for you? What do you actually want out of this consultation? And then you have to do the admin work of typing up the notes and prescribing the medications or making that referral. All of that within 10 minutes, which is wild. You think about, in a corporate setting, a 30 to 60 minute meeting will have the same kind of agenda. It will have the same depth of discussion. It will have the same debate around what the best options are. And then the outcome will be, after that 30 to 60 minute meeting, that all of the jobs that are generated will need to get done.
Yeah, and
that's insane.
It's insane, because you're making decisions about people's livelihood and the cognitive overload of making that fundamental decision every 10 minutes. And in reality, a lot of the GPs only have 7 minutes. It's quite stressful. You finish the day totally drained, because you have to put all these puzzles together every 10 minutes for a different person altogether, and they've got social issues and everything else that goes with it. Yeah, it's insane. I don't think many people appreciate it. Maybe they experience it, they go and see their GP and they feel they're being rushed in and rushed out of the door. But for the person sitting in the clinic, you know, welcoming these people in is quite emotionally and physically draining. So
I wanted to intervene, Basin, just because I want to tell how much I appreciate GPs and the job of GPs. Like, you watch them work and it is astounding. the level of intellect, the level of time management, crisis management, conflict management, empathy, people skills, and sheer scientific knowledge that these people have to do all this within 10 minutes, as well as handle the amount of admin and somehow still manage a personal life with their families as well. Just GPs do not get enough appreciation.
Oh, thank you. Thank you for highlighting that. So here we are, a GP who is seeing patients. They're lucky if they've got 10 minutes, because as I said, most GPs probably have in reality 7. They're, triaging these patients and trying to make a decision. When pharma communicates with you, what makes you think this is really worth my time? And what makes you think I need to filter this out immediately because it's just noise? What resonates with you that really genuinely adds value?
That, I have to say, is a question you'd have to ask multiple people, and you'd get probably different answers every time, but you would get recurring answers. And I think it comes back to the chapter in your book, Mehrnaz, in terms of HCPs are humans too. And as we've established, humans who have a ridiculous workload and are in a constant state of cognitive overload, where they are just about managing all the things in their day-to-day. What moves the needle for us is essentially, what is best practice for our patients? What are we doing and what are we changing? One of the things that comes into mind for me is that Nice Guidance released a new updated guidelines for type 2 diabetes on the 18th of February 2026. Now, we kind of knew that some of these changes were coming, and obviously there have been lots of advances within the past few years when it comes to diabetes management, but without naming names of pharmaceuticals, it's the tablets, the different kinds of formulations, the injectables, all those different things now are pretty much first line. That has all happened in a very short period of time, whereby the clinical trials and the weight of medical evidence shows how these newer formulations or this new combination of medications is having a significant impact on these patients' cardiovascular and renal profile. And that kind of thing is directly relevant to my daily practice. If a patient comes in with new onset type 2 diabetes, if their HbA1c is over the threshold, and then I'm like, okay, I need to start medication A, and then as soon as they're settled on medication A, I should be starting medication B. But then I need to think, with these new guidelines and the evidence, it's actually showing that these particular subsets of patients are really going to benefit from injectable C. And that's all changed so quickly. So if I get a piece of information that comes my way, whether it's like a short form or like an education piece in my email, or a testimonial from a fellow healthcare professional, or some kind of evidence that how this has helped patients, like that story aspect of it, and alongside the science, then I think that really resonates. Because at the end of the day, someone like me, I'm of course a scientist at heart. I like to see what the data shows, what is the p-value, what is the n number, how what's the number needed to treat. All those kinds of measures are first and foremost in my mind. But at the same time, if I am tired at the end of a clinic, I also want to know, how is this going to help me, and how's this going to help my patients? Like, is it going to mean that the patient in front of me is less likely to get diabetic neuropathy in a couple of years' time, does that mean they're less likely to have to come in to my clinic and be managing the sequelae of, having an amputation in their mid-50s? That's the kind of thing where I'm like,
yeah, it makes a lot of sense. So what really helps you is things that are genuinely helpful is things that simplify treatment decisions in line with the updated guidelines, evidence, and also stories of real, best practices done by other similar doctors. And you always say this to me, it's stuck in my head, in a snackable chunk, because you're running busy, so you need to be able to have that information in a succinct, snackable chunk so you can consume it as you go about your day, rather than have pages and pages of clinical paper. Would that summarize what you said?
100%, because I think we talk about omnichannel, we talk about opti-channel. Ultimately, all of those are code words for how can we best serve our audience, whether our audience is HCPs in this case, or whether in awareness campaigns it's patients. And more often than not, the clinician isn't going to read a 30-page PDF. But if there is a short summary where there is the references to the primary papers, or there is a link to a short form video that summarizes the findings as well as a longer form video, it just provides those options whereby the HCP, the poor HCP at the end of it, actually has a way to meaningfully engage with that content without further contributing to that cognitive overload. In actual fact, that actually reduces their burden.
Yeah, Azmain, I've seen so many detail aid, like 30, 40 pages, and it just repeats the same point in a different way. And it just, by the time I get to page 8, I'm bored. So much said for the recipient at the other end. I just want to jump back to a previous conversation, because Natasha put a question up. I've not brought it in because we were talking about like going into a day in the life of a general practitioner. But Natasha's talking about, first of all, congratulating you on your 5 years of content creation. But she's talking about misinformation. I think the question she's asking is, did you, when you're putting content on social media, did you ever worry about the negative scenarios or legal backlash? And, or did you put precautions in place to avoid any litigation, I guess?
Oh, brilliant question. And the honest answer is, it's still scary. You are putting yourself out there in front of the world. I mean, my videos have got hundreds of millions of views. And you are, you have to be very careful of the repercussions. The one thing that I think has reassured me is, for example, I had a chat with a bunch of us had a chat with the GMC, and those of us on the call, prior to the call, the GMC had basically gone through our content and basically given us the green light to say that, yeah, you guys are doing a pretty great job of this. You actually have the systems in place to be able to manage the risks surrounding this. There are obviously things to consider, like, being obviously not promoting prescription only medications, big no. But you also have to be careful with other brand partnerships, like various unresearched supplements that come through the door. You can easily lose your credibility. But even today, I got an email, or a couple of days ago, from one of my close partners within, not directly healthcare. I can't reveal too much, but I'm very close with this group of people to be able to talk about these messages, but there are sometimes that I have to be firm in terms of my values, that, you know, my audience trusts me for X, Y, and Z reason, and that's why I can't do this. And I think that builds respect when you respect your own values. The fact that, you know, I myself, I'm an NHS doctor, GMC registered. There are certain ethical guidelines that I have to adhere to, not, you know, ASA guidelines, and ABPA guidelines, all of those as well. But if you stick to your values and you stick to the mission of, you know, delivering high quality education, it's, I think it's difficult to go wrong if you have that in mind. And I should say the GMC also said there is nothing wrong with you making money on the side, but the only problem they would have is bringing the profession into disrepute. And there are ways to do that. But I am so glad that over the past 3+ years, I have built the community of practice of these clinician creators where we are so open and honest with each other about, you know, when a brand deal comes through, is this ethical? Are there any caveats that I should be worried about? And then that is the way to navigate it. And in terms of negative scenarios, the only other negative scenario is getting hate comments, and that you will get anywhere in life. One of my close friends in medicine said, if you're not pissing someone off, you're doing it wrong. But also, you realize that when the videos go viral, you are getting the hate comments because it's reaching out to a larger audience. If you're talking about the importance of vaccinating against measles, then you are going to get some hate comments. But, you know, I posted that video and the Department of Health and Social Care liked it and shared it. So this is clearly something that is for the public good. So that backlash is something that is always a risk. But as long as you're towing the line and stick to your own values and espouse those tenets of, you know, trying to do the best for public health, then I think it's difficult to go wrong.
Yeah, it's good that you found your voice. And I think the top tip you've got from there is just use your values as a guiding principle. Just in the interest of time, I'm just want to squeeze in another more question. My goal was to make this episode more succinct, but I'm not that good at being succinct. So
I'm so sorry.
I was going to say, I'm just really curious to ask you about like digital trust, AI, and looking in the future, specifically looking at pharma, because this gives me a chance to get your perspective. What pharma, what frustrates you most about digital engagement from pharma, and what do you want us to do differently to stay more relevant and in tune with the reality of your work?
I think, if anything, the obvious just resonating more with us, especially, you know, I'm on that cusp of Gen Z and millennial, but I can clearly see what my Gen Z colleagues resonate with. They are the TikTok generation. They are less interested in the super polished videos that come up on their social media feed. They want authenticity. They want the unfiltered thoughts of their peers. Now, I don't say that to try and convince pharma, screw compliance, just get out your phone and put out whatever onto the internet. It's to say that, you know, one of my favorite phrases is that creativity and compliance should shake hands with each other. And I think that if we're going to reach out to that generation and rebuild their trust when they've grown up hearing about big bad pharma, then I think it needs to be about the people, because digital doesn't just mean, you know, let's tick off the emails, let's tick off the newsletters and all of that. I mean, you know, the reps and the MSLs still have a place in the physical world, and that human connection is important. But as we say, like we mentioned just beforehand, the fact that we are connecting online, and it's this is the kind of connection that pharma can create with its HCPs. It's not just about lecturing from one end to the other. It's about understanding the pain points, understanding, you know, that my colleagues are struggling to get their foot on the career ladder because there are simply not enough jobs for medics, whereas they've desperately spent their lives studying medicine in order to help other people. So it's just those kinds of things that really the struggles that only HCPs know about, but pharma might sit on their ivory tower and only think, you know, how can I improve conversions, without really realizing what is going to click in my HCP's brain when I say, I understand your struggle and this is how we can help.
Yeah, as you know, you and I have spoken to each other. My son is a registrar in psychiatry, and everybody say, "Oh, isn't that wonderful?" But there's a bottleneck. They get to so far, they can't apply for higher training because there's not enough training places. And UK is crying out not having enough psychiatrists, but you don't have an opportunity to train them because there's a bottleneck. And I think, just going back, I think people tend to forget HCPs are not targets. They're people, they're human, they have feelings. They don't wake up in the morning thinking about molecules. They're thinking about how I'm going to get through my day and how I'm going to be able to maintain healthy life balance with a ridiculous amount of work I'm expected to do with a cognitive overload. And I think if I was going to give advice to pharma, just imagine you're talking to another human being with their, you know, tremendous pressures, that you're not talking to a target. Just to kind of wrap things up, you alluded to one of the chapters in the book. Was there anything in the Omni Advantage that resonated with you, or any advice that you have for me to consider?
I think that's just genuinely understanding the HCP at the end of the pipeline is such a crucial element. And I think that's something that you have absolutely nailed, Mehrnaz. It's just the fact that you, as someone who has been a healthcare professional yourself and then gone into industry, understands better than anyone, is that it's all about the people. And we say it time and time again, but I don't think it can be stressed enough.
Yeah, I remember one time I was working in ITU and my boyfriend ringing me, and then he was annoyed why did I not answer him. I said, I had to resuscitate them 9 times. I don't have time to talk to you. I need to deal with someone's life. And I remember my first job was selling to anaesthetists who worked in ITU, and I walked in, I had an appointment, driven an hour to see them, but they had a crash. So I turned around, walked home, because I knew even if they had time to see me, they're not going to be in the right frame of mind, because that patient either passed away or still in a really critical condition. And I think those reality of life as a medic or a nurse or a healthcare professional is something we need to really empathize with. And once we understand it, we can communicate differently. It's not about delivering our messages around understanding with empathy and kind of putting it within that context. We can genuinely help healthcare professionals, but we need to seek to understand, we need to listen, rather than just one-way communication trying to echo our messages.
Absolutely.
So Azmain, also wanted to say I'm really excited because I've been working on the 2nd edition of the book, which is going to be published this year. We've got 2 new chapters. One's on social media, which I'm absolutely delighted because Azmain has kindly contributed to that chapter, and another chapter on AI. I just want to say, Azmain, thank you so much. It's been a real pleasure having you with us today, and I really truly appreciate your openness and the perspective you shared, but also want to say thank you to all our people who joined live and contributed to this conversation. As I said, those questions we didn't manage to answer, we will definitely answer on LinkedIn. And I just want to say, if there was one takeaway message from today, this is like from the, first of all, one of the top things that you shared that I wrote down is creativity and compliance need to shake hands. I love that. Compliance shouldn't stop creativity. And Arena is probably the biggest champion to show it is possible to do both. And I think the key message is meaningful engagement is not about more content, it's about relevant content in size that is easy to digest. And we should really start by listening and understanding to get there. Azmain, is there anything else you want to add before we close?
I think that summarizes it beautifully. Thank you so much for having me, Mehrnaz.
It's my pleasure. And I just wanted to say this year marks 40 years I've been in healthcare. And I've been reflecting on this year. I joined NHS as a nurse in 1986, and I want to give something back. So I've started a small initiative to support UK pharma companies in strengthening their engagement with NHS. If this speaks to you, please feel free to connect with me directly. Thank you so much for all of you for being here, and I can't wait until our next episode. Bye, everyone.